Hello everyone, my name is Ari Ramos and today I'm presenting an innovation designed to improve safety in aged care. The Integrated Infection Prevention and Control Improvement Program, or the IPCIP. In this presentation, I will walk you through why this innovation is needed, the gaps it addresses, the resources required to implement it, and the benefits it will deliver for residents, staff, organization, and the wider community. Let me begin with the problem. Healthcare associated infection remain one of the biggest patient safety risks in residential aged care. Our residents are among the most vulnerable people in the healthcare system due to frailty, chronic illness, and age related to immune decline. At Digas, infection surveillance identified persistence and unresolved infections, particularly fungal infections in residents over 75. These highlighted a need for a more proactive and integrated approach. The Integrated Infection Prevention and Control Improvement Program brings together a real-time surveillance using eye care, hand hygiene, and PPE monitoring, antimicrobial stewardship, staff competency education, and standardized outbreak escalation. The goal is simple but powerful: to move from reacting to outbreaks to preventing infections before they occur. Infection prevention in aged care is now a global priority. Older adults experience higher infection rates, more hospitalization, and greater risk of antibiotic resistance. The drivers for innovation are clear: an aging population, increasing antimicrobial resistance, workforce skill variability, and the need for stronger governance and surveillance. To meet modern patient safety expectations and national standards, innovation is no longer optional. It is essential. Australia already has a strong infection control standards and policies. We follow national safety standards, infection prevention guidelines, and antimicrobial stewardship frameworks. Yet, infections continue to occur. These tell us something important. The problem is not the absence of policies, but the gap between policy and practice. What we need now is better implementation, monitoring, and integration. Audits reveal inconsistent hand hygiene compliance, variable PPE use, delayed escalation, and limited real-time surveillance. In simple terms, we have the rules, but we need better system to make following them easier, faster, and more consistent. Another major challenge is fragmentation. Training is inconsistent, antimicrobial stewardship engagement is limited, and the infection control strategies often operate in silos. Without integration, accountability, and feedback, improvements cannot be sustained. The good news is that this innovation is low cost and uses mostly existing resources. These include the IR surveillance system, the CREA audit tool, and the free national training resources. Simple tools like posters, dashboards, and QR codes will help bring real-time infection information directly to the staff. By scanning a QR code before each shift, staff can instantly access the facility's infection status, safety updates, and escalation pathways. This makes infection prevention visible, accessible, and easy to act on, turning information into action. Infection prevention is not just a policy, it is a responsibility we carry at the start of every shift. That's why the IPCIP QR code is a game changer. Before providing care, every staff member simply uses their phone camera to scan the QR code. Within seconds, you have a real-time access to the facility's current infection status, outbreak alerts, PPE requirements, and escalation pathways. No searching, no delays, no uncertainty. Just clear, immediate information that protects you and protects our residents. Through this platform, you can review current infection updates before entering a resident's room, check standard precautions and PPE requirements, access the Antimicrobial Australia reference file, view the IPCIP training calendar, and most importantly, escalate concerns instantly. If you identify a risk, you act immediately. For example, 3167, room W33, COVID positive on what? Immediate action required. That single report activist isolation protocols, PPE enforcement, hand hygiene auditing, and updates the dashboard for the incoming shift. This is proactive infection control in action. We are also delivering short, focused 20-minute IPC in-service training sessions led by the infection control lead nurse. These sessions fit into handover or low acuity periods to minimize disruption while strengthening competency and confidence. This program directly supports compliance with the aged care quality standards, particularly Standard 3, Personal Care and Clinical Care, and Standard 8, Organizational Governance. But more importantly, it protects lives. The QR system transforms infection control from something we respond to into something we stay ahead of. Every scan, every shift, every resident. This is how we build a safer aged care environment. Sustainable change requires strong leadership and staff engagement. Using Levin's change model, we will build awareness, implement new practices through education and support, and embed them into routine training and audits to ensure long-term success. This chart provides an overview of the IPCIB Champions pathway, outlining the key roles and responsibilities to support safer care, including leadership and IPC champions, education and competency training, structured change management, and multidisciplinary collaboration. The expected benefits are significant. Fewer infections, fewer hospital transfers, earlier detection of illness, improved staff confidence, and more consistent care. Beyond the facility, this innovation strengthens governance, reduces outbreak costs, limits antimicrobial resistance, and contributes to better public health outcomes. This final concept map visually represents the full journey of the innovation, from identifying the problem to achieving sustainable improvement. We begin with the problem. Persistent healthcare-associated infection is a highly vulnerable aged care population. From there, we identify the gaps, inconsistencies in practice, fragmented systems, limited real-time surveillance, and variable staff competency. The innovation, the IPCIB program addressed those gaps through an integrated data-driven approach that connects surveillance, antimicrobial stewardship, PPE compliance, and escalation system into one coordinated framework. However, innovation also is not enough. That is why education is central, equipping staff with the knowledge, confidence, and clinical reasoning required to act early and consistently. We then reinforce change through structured audits and feedback, creating accountability, visibility, and continuous monitoring. This action leads to measurable outcomes, reduced infections, fewer hospital transfers, improved staff confidence, stronger governance, and decreased antimicrobial resistance. And when education, surveillance, leadership, and auditing are embedded into everyday workflow, we achieve sustainability, where safe practice becomes routine, not reactive. This concept map demonstrates that sustainable infection prevention is not one single action. It is a system, integrated, supported, monitored, and continuously improved. Ultimately, this innovation is about protecting our residents, empowering our workforce, strengthening organizational governance, and building a safer, more resilient future for Australian aged care. The concept map shows how governance, education, surveillance, and auditing work together to create sustainable improvement. Ultimately, this innovation is about protecting our residents, supporting our workforce, and building a safer future for aged care. Once again, this is Ari. Thank you for watching.